Hi everybody, and welcome to our module on pigment disorders. Let's start by talking about melanin. Melanin is a black-brown pigment, and it's what gives color to your skin and also to your hair. And in the skin, its role is to protect the skin from damage by ultraviolet radiation, like the type that comes from the sun. And it's high yield for your board exams to know that melanin is synthesized from the amino acid tyrosine. This is the structure of tyrosine shown on the screen here, and multiple tyrosine molecules are modified and linked together in order to produce the pigment melanin. Melanin is synthesized by skin cells called melanocytes. These are specialized secretory cells, and they are derived from the neural crest. It's high yield to remember this for your boards. So the skin and the central nervous system are often linked embryologically. You may know that both the epidermis and the central nervous system derive from the ectoderm, and this is just another example of how they're linked in that neural crest cells migrate into the skin, and that's what forms the melanocytes. You can find melanocytes in the basal layer of the epidermis. In the video on the skin, I talk about the layers of the epidermis, but by way of review here, let's look at this picture on the screen. This layer right here that sits right on top of the dermis is called the basal layer of the epidermis, and that's where you can find melanocytes. These cells synthesize melanin in specialized intracellular organelles called melanosomes, and then the melanosomes are transferred from the melanocytes to the keratinocytes higher up in the epidermis. So most of you probably know people who have freckles, or you may have freckles yourself, and this is the classic example of a skin finding related to the pigment melanin. Freckles are small brown dark macules. They are flat and they can darken on exposure to the sun. This is a picture of a person with freckles on their face, and what causes freckles is increased amounts of melanin. Some of us are born with biology such that parts of our skin synthesize more melanin, and that will create freckles. The number of melanocytes is normal, the density of melanocytes is normal. It's just the amount of melanin that is synthesized is higher in certain areas than others, and that creates these small freckles as shown in this picture here. Albinism is a disorder where people cannot normally synthesize melanin. So as you can imagine, these people will have unusually light skin and hair. Albinism is often called oculocutaneous albinism, or OCA, and the reason it's called this is because in addition to the skin, the eyes are also often involved. Albinism is a family of genetic disorders. There are a number of subtypes. They are all autosomal recessive. And individuals with albinism have absent or reduced melanin synthesis by melanocytes. The number of melanocytes they have is normal, it's just that they are synthesizing less than they normally would. And although there are many forms of albinism, the most common forms are caused by decreased activity of the enzyme tyrosinase. Remember how I said tyrosine is the amino acid used to make melanin, and the enzyme tyrosinase synthesizes molecules of dopaquinone from molecules of tyrosine, and then multiple molecules of dopaquinone are linked together to form melanin. So you can imagine if this enzyme is not normal, you won't be able to normally synthesize melanin. If you understand the normal role of the pigment melanin, it's very easy to understand the clinical findings in albinism. There's widespread hypopigmentation, meaning that structures are lighter than normally they would be. So this includes the hair is very light, the skin is light, and also the eyes tend to be blue. So these individuals have white hair, a pink skin color, and blue eyes. And this is a picture of a boy with albinism on the screen here. In addition, because one of melanin's role is to protect from ultraviolet damage to the skin, these children have an increased risk of sunburn. They tend to sunburn very easily, and they have a higher risk of skin cancer because they don't have the normal UV light protection. So all forms of skin cancer, basal cell carcinoma, squamous cell, and melanoma, are found at higher rates among people with albinism. Moving on, let's talk about melasma. Melasma is an acquired disorder, so it is not genetic, it is not inherited, and you can think of it as the opposite of albinism. In this disorder, there's hyperpigmentation, meaning excess melanin present in parts of the skin. This disorder most commonly occurs among women, and it leads to irregular areas of tan dark macules on the face. These are often symmetrical, and they're often in sun-exposed areas of the face. This is a classic picture shown on the screen here. This woman has melasma, and she has these dark tan spots on her cheek. These are symmetrical and in the sun-exposed areas of her face. And it's more common among women who have dark complexions at baseline. Melasma is triggered by UV light in a susceptible woman, and this leads to increased melanin synthesis. Like I told you before, this is like the opposite of albinism. Classically, the onset occurs when a woman becomes pregnant or starts taking contraceptive pills. It's believed that the increased levels of estrogen can trigger melasma in a susceptible woman. In fact, this disorder is sometimes called the mask of pregnancy because it commonly occurs among women who are pregnant, and in that case, it usually resolves after pregnancy. It's basically a cosmetic problem. There aren't any dangerous sequelae of melasma, but some women are bothered by the discoloration on their face, and there are some treatments for it. First of all, sun protection helps because, like I told you, it's triggered by UV light. And then there are skin lighteners like a drug called hydroquinone, which inhibits tyrosinase and decreases the amount of melanin in the skin. The last disorder we'll discuss is vitiligo. This is also an acquired disorder, and it's a localized pigment disorder, meaning it does not affect the entire skin, just portions of it, usually symmetrical portions. This is an autoimmune disorder in which there's autoimmune destruction of melanocytes so that focal areas of skin lose their melanin production. Patients with vitiligo are asymptomatic, so they don't have any itching or pain, but what they do have are depigmented, meaning white areas of macules and patches that are usually symmetrical. This is a classic example shown on the screen here of a person who has these white spots on his or her fingertips. That's caused by vitiligo. There are no clinical signs of inflammation. Even though it's autoimmune, you don't see things like warmth and redness. And because it's autoimmune, it can be treated with immunosuppressant drugs like steroids and other immunosuppressants. So in people who are dark-skinned, this is a very obvious disorder where there are areas of depigmentation, just like this example on the screen here. In people who are very light-skinned, though, the vitiligo may not be evident until they go out in the sun. So a classic presentation to know for your board exams is a person who goes to the beach and comes back and is suntanned on his or her entire body except for a couple localized regions. That person may have vitiligo. And this is just a cosmetic problem. There really aren't any serious pathological sequelae of it, but obviously you can imagine if your hands begin to look like this person on the screen, that can be very troubling and be a significant cosmetic problem. And that concludes our video on pigment disorder.